Review the quiz we had today. So let me start the quiz now. Question 1 says, a 54-year-old male was rushed to the emergency when he collapsed in the middle of a business meeting. Examination revealed excessive sweating and high blood pressure. ECG chest was conclusive of acute myocardial infarction. Which biochemical investigation out of the following would be of no help in the confirmation of the diagnosis? So the one that is not really cardiac specific should be lactate dehydrogenase. The rest are cardiac specific. Cardiac troponins are there. Creatinine phosphokinase is of cardiac origin. Serum myoglobin is also of cardiac. So lactate dehydrogenase is not correct. It's the one that is odd there. DNA has both autocatalytic and heterocatalytic functions. That's correct. That's the correct answer there. Question 3 says, a 27-year-old woman with epilepsy had been taking phenytoin to control her seizures. She is now pregnant and her physician is considering changing her medications to prevent potential bleeding episodes in the infant. What biochemical activity might be deficient in the infant if her medication is continued? So phenytoin would tamper with gamma carboxylation of glutamate, which will affect clotting factors 2, 7, 9, and 10. Which phospholipid out of the following is a component of the inner mitochondrial membrane? The answer is cardiolipin. Question 5 says an increased TM, that's melting temperature of the double-stranded DNA, may be due to high content of C and Gs have 3 hydrogen bonds joining them, so that will make it have an increased melting temperature. Question 6 says which type of lipids is left undegraded in name and pick? The answer is sphingomyelin. 7 says which of the following mucopolysaccharide is non-sulfated and most abundant in tissues? The answer is hyaluronic acid. Then question 8 says choose the incorrect statement about active site of an enzyme. The incorrect statement here is active site takes up large part. It's actually a small part. I use an example of an enzyme is the body, the mouth is the active site, the teeth are the coenzymes. Question 9 says choose an aldopentose. The answer is arabinose. Question 10 says a 6-year-old boy had meconium ileus at birth. He has now developed chronic productive cough and bulky fat containing stools. Which of the following is the most likely at risk for? So this child has cystic fibrosis and he's having steatorrhea, that's the fat bulky stool. So fat containing meals which inclusive of vitamin ADEC cannot be absorbed properly, and one of the deficiencies of the fat soluble vitamins here is going to be rickets, deficiency of vitamin D. So that's what the child might be predisposed to having. So that will be the end of the quiz. Let me finish it and see my score. Voila, I had 100%, and because I was teaching, my time was longer. So congrats to the people that won today's quiz contest.